My name is Brianna. This is the Diverticulitis NCLEX question and answer video. The first question says, the client is scheduled for a percutaneous liver biopsy. Place an X in the quadrant where the nurse should tell the client that the needle will be inserted. Think about where your liver is, and your answer should be as such, the right upper quadrant. Okay, on to the next slide. Here's the rationale for that. You can pause the video to review the rationales. We're going to go ahead with the questions. The client has, our next question. The client has diarrhea and refuses to drink the prescribed oral hydration solution, insisting on having chicken broth instead due to the cultural belief. Which statement best describes the possible reason for the client's request for chicken broth? Okay. It would be one. It has yang qualities. You know, we have to think about this yin and yang when we're dealing with cultural beliefs with our patients. Okay, and the rationales are behind each question, so you can review those in your spare time. The next question says, the nurse is preparing to care for the client who just had a Whipple procedure. A Whipple procedure, you're getting out most of your you're getting rid of that top of that pancreas, that gallbladder, and a piece of your liver. So it's a major surgery. So what should the nurse include in the immediate plan of care? Monitor blood glucose levels? Oh yes, because that pancreas is getting removed. We don't have insulin, and we need sugar to survive. So that is priority here. Okay. And it'll explain there. Our next question says, the nurse is caring for the client with a Zinker diverticulum. Think about what a Zinker diverticulum is. It's not in the GI. It's in the GI, but it's not the lower part. It's in your esophagus area, and food can get trapped down in there. You can aspirate it. So which problem should be the nurse's priority? 1, pain related to heartburn from gastric reflux? No. Aspiration related to regurgitation of food accumulated in the diverticula? Definitely. Just gotta, Google these things and research what these weird names are so that you can better get a understanding of what the question is asking. All right. Okay. The nurse is admitting the client with gastric cancer to an oncology unit for treatment. Which assessment findings should prompt the nurse to review the medical record to determine whether the cancer may have metastasized to the peritoneal cavity? Okay. Client report nausea. That's not really a sign. That could just be food, homesick. Graves' Turner sign. That's not really what we're looking for. That's with pancreatitis. The client reports a rapid weight loss. That's not really a give or tell. Ascites is evident. Yes, if the cancer yes, we'll explain the rationale. But yes, if those ascites, you got accumulation of something, that could definitely be an indicator that something has spread somewhere. Okay. And here's the rationale. Okay. The next question says, the serum ammonia level of the client with cirrhosis is elevated. What should the nurse do? Monitor for temperature elevation, observe for increasing confusion. I like that, because think about what ammonia does. It's very toxic. The liver needs to take that that protein that the body digests it and turn it to ammonia, and then it turns. Okay, the byproduct for the liver breaking down the protein is ammonia. It takes that ammonia and turns it to urea so that we can secrete it in our urine. If it's not, your liver's not working, it's not able to do that. So ammonia is very toxic. So you have changes in your LOC. All right, so we're going to observe for that increased confusion. There's a rationale for that. You can just pause when it's on the rationale so that you can have time to read through. Okay. The next question says, the client with cirrhosis is scheduled for TIPS, transjugular intrahepatic portosystemic shunt Okay, placement. The nurse realizes that the client does not understand the procedure when the client makes which statement. Think about what this procedure is. Um, let's read our let's read our answers. I hope the abdominal incision heals fast after this procedure so I can return home. Well, think about this is not going to be an abdominal incision. It's going to be above the abdomen, So I'm liking that already. My risk of bleeding from esophagus from my esophagus should be decreased after the procedure. That doesn't sound like he needs a understanding. Okay, that's true. The shunt they are placing could become occluded in the future. I hope it doesn't happen. It can become occluded. It is a man-made shunt. This procedure should keep me from getting so much fluid built up in my abdomen, and that's exactly what this procedure is for. So the answer is 1. Oops. And here's the rationale. Pause if you want to take a look at those. Our next question says, during a clinic visit, the client provides all of the following health history information. Which client statement should be most concerning to the nurse because it could describe a symptom of esophageal cancer? Let's read our options. 1, I have been having a lot of indigestion lately. That's not necessarily esophageal cancer related. When I eat meat, it seems to get stuck halfway down. Oh, yeah, this is already clicking in my head. That's it. I have been waking up at night lately with chest pain. You could have a heart attack. You could have a GERD. I gain weight even though I have not changed my diet. You could have. I gained weight. If you got esophageal cancer, your chances of gaining weight is a little slim. Okay, because you're not. So when I eat meat, it gets stuck halfway down. You got esophageal cancer. That cancer is causing those cells not to function as it should. So peristalsis is not happening. So this is an indicator that this might be esophageal cancer. All right. So here's our rationale there. You can take a look at that. All right. Next question. The client who has chronic pancreatitis is concerned about pain control. Which initial plan for chronic pancreatic pain control? Which initial plan for chronic pancreatic pain control should the nurse explain to the client? Opioids such as morphine. We like that one on a lot of questions, but let's read on. NSAIDs, we don't want any blood thinners because with pancreatitis, those enzymes are cutting, they're eating through the tissue. We don't want to risk our chance of bleeding internally with this blood thinner drug here. Pancreatic enzymes with H2 blocker medications. Yeah, I like that. We're gonna decrease that stomach acid. We're gonna also go ahead and get that enzymes to help digest the stuff for you. Hold on, we're gonna read the rationale for this one, so I'm not trying to confuse anybody. For injection of medication directly into the nerves. No, let's go ahead. We're gonna review this rationale because I want to explain to y'all what those H2 blockers and pancreatic enzymes do. Okay. So it says the initial pain control measures include exogenous pancreatic enzymes because pancreatic stimulation by food is thought to cause pain. Pancreatic enzymes are coupled with H2 blockers, which block the action of histamine on parotid cells in the stomach. H2 blockers are used because gastric acid destroys the lipase needed to break down fat. And you could just dwell on this rationale and to get an understanding. There's H2, just reread the rationale and then explain it to yourself a little bit better. Okay, we need those enzymes because lipase, the H2 breaks down the lipase that's needed to break down fat. So we're gonna get those So the gastric acid destroys the lipase that's needed to break down our fat, and we don't need that. So next question. The nurse is caring for the client who was 6 hours post-op cholecystectomy, the removal of the gallbladder. The client's T-tube drainage bag is empty, and the nurse notes slight jaundice of the sclera. Which action by the nurse is most important? We know about jaundice. Well, our liver is not working. There's yellowing in the skin, yellowing in the eyes. This is bad. Ammonia is building up. The liver's not, doing what it's supposed to do. Is it one, reposition the client to promote T2 drainage? Well, positioning him is not going to necessarily help or the way we want it to. We don't want to manipulate the surgeon's surgery whatsoever. So if it's not draining, we're going to report it, okay? Telephone the surgeon to report these findings. Yes, because he has jaundice already. That's meaning that the liver is not functioning. There's something causing it to be not working the way it should. And if it's building up, that's letting you know that ammonia could be rising. And when it comes to ammonia, you can go to a coma and even death. So that jaundice is an indicator we need help right now before he's there or he or she lose liver loss of consciousness. Okay. Ask the CNA to obtain a blood pressure. We don't need that. Nursing assistant, same thing for a CNA. We don't need a blood pressure right now. We need to report these findings fast. Okay. Record the findings and continue to monitor the client. We're not going to continue monitoring nothing. We're going to tell somebody. We're going to tell the surgeon. All right, and the rationale is there. That wraps up our NCLEX question video. I hope you learned something. I hope you enjoyed it. Thank you.